So I'll be starting with CPT guideline, that is the Path and Lab series, 80,000 series. So let's begin. Always when we start any session, please take some time to just go through the index. It helps you to understand how the chapter has been designed, and it will help you to navigate the chapter better. So the chapter begins with the organ or disease-oriented panel. These are the guidelines and these are the various panel codes. So you will see that this is the name of the panel 80047 basic metabolic panel, and this particular panel includes all these tests. For your better understanding, I have written the number of the tests which are included in every panel. So just take time to go through all these panels. So there are certain guidelines to the panel. The first guideline is code in this section are used whenever all the specific tests listed under the panel heading are performed. Second guideline is if one or more tests listed is not performed, the panel code may not be used and the specific test must be coded separately. If a group of a test overlap two or more panels, report the panel that incorporate the number of the tests to fulfill the code definition and report the remaining tests using individual test codes. And do not append the modifier 52 on the panel code, and even the modifier 22 can't be appended to the panel code. So these are important rules and we are going to go detail into those rules. So let us decipher the rule number 1. The rule number 1 says the codes in these sections are used whenever all the specific tests listed under the panel heading are performed. So let us assume the panel 80047. I can write 80047 when all these tests like from the calcium analysis till urea nitrogens are performed. Then only I can write the panel code. So let us take one example to understand this particular rule. Dr. Patel evaluated Jack, a 45-year-old male with a sign of fatigue and muscle weakness, to assess his kidney function, electrolyte level and glucose. Dr. Patel ordered the following lab tests: calcium ionized, carbon dioxide bicarbonate, chloride, creatinine, glucose, potassium, sodium, burn test. What is the correct CPT code to report this test together? And we have this option. Now, if you look at the code 80047 and 48, this is both are basic metabolic panel. But remember, you have to be very particular in tallying all the tests. So if you see this 80048, it also has almost all the tests that you will see in the 47. But only thing is, this is calcium ionized, this is calcium total, and this particular panel code does not have burn test. So, and in our patient case, all these tests are there. So if I tally all these tests, they all 100% tally happens in 80047. You can take it, calcium ionized, calcium ionized. That way you can tally. So what will be my answer? I can just write the panel code 80047 because our guideline says that if all the tests from the panels are there, I can write the panel code. So 80047 will be my answer. Now let us understand the rule 2. Rule 2 says if one or more of the tests listed is not performed, the panel code may not be used and the specific test must be coded separately. So understand this rule. Let us take example. Following lab tests were performed on Mr. Drew: calcium ionized, carbon dioxide, chloride, creatinine, potassium, sodium, glucose. How should Drew's lab work be reported? So let us see all these tests and we will match these tests with a different panel. So if you see 80047, calcium ionized, carbon dioxide, chloride, creatinine, glucose, which is there, potassium, sodium, all the tests are there. But wait, there is one test which is not there. So the panel code 80047 cannot be used because urea nitrogen, that is a burn test, was not performed. Therefore, the individual test must be coded. So what will be my answer? C will be my answer. Let us take the third rule. If a group of tests overlap two or more panels, report the panel that incorporate the number of the tests to fulfill the code definition and report the remaining tests using individual test codes. So let us take example. To understand this rule, patient had the following blood tests completed as a part of her primary care physician's described metabolic panel, albumin, bilirubin total, calcium total, carbon dioxide, chloride, creatinine, glucose, phosphatase, alkaline, potassium, protein total, sodium, transferase, AAT, SGPT, AST, SGOT, urea nitrogen. So there are a number of the tests which our doctor told him to do. And we have this option. So let us see what's the answer. So if you see all these tests, you will realize that all these tests, they are the part of 80053. So it is the comprehensive metabolic panel. So we have two types, basic metabolic and a comprehensive. But we saw most of the tests are in the comprehensive. And if we tally the tests, all the tests which are there, they are in the doctor's description. So I'm going to take 80053 because unless all the tests are there, we cannot pick up the panel code. So I will take the panel code. Now there are two tests which are not the part of the panel code. So those are the 82248 and 86709. So you can take those tests by adding the additional test code. Okay, because that way it is it is allowed that one complete panel code which includes most of the tests, and the two tests which are not a part of the panel code, I am writing the individual test code, and this is the answer for this question. And rule 4 is do not report 80047 in conjunction with 80053. So basically if you compare these two panels, this is the comprehensive and this is the basic. Basic has few tests while the comprehensive has additional tests. So you cannot write these two code together, because this is a lesser version and this is a bigger version. So this is the rule 4, and the rule 5 is never put a modifier 52 and 22 on the panel code. 52 is reduced service and 22 is the more time requirement. So we will never put those two modifiers. So let us take one question. Physician order a basic and a comprehensive metabolic panel with a calcium ionized. Select the code on how this is reported, and we have the four options. Now when there is a basic and a comprehensive, I'll always go for the comprehensive, because if I take basic, there are many tests which are missing and I'll end up writing unnecessary many codes. So I will take the comprehensive metabolic panel because that is ordered by the doctor, and calcium ionized. So let us take whether let us see whether the calcium ionized is the part of the comprehensive panel. It is not the part of the comprehensive panel. So tell me what is the answer. So yes, D is the correct answer, because we will write 80053 for the comprehensive metabolic panel, and 82330 it is a calcium ionized which is not in both the metabolic panel, and that's why we will add that additional test. Okay, so the simple rule is all the tests has to tally. One test less, we cannot write the panel code. One test more, we can write the panel code and we can include that additional test. So let us understand what is drug assay. Drug assay, which is often called as a drug analysis or a drug testing, it is a lab procedure which is used to identify, quantify, measure the presence, concentration and activity of a drug or the metabolites in a biological sample. Biological sample means blood, urine, plasma, tissue. Now, why do we do the drug assay? Is to first of all detect the presence of a drug, or measure the amount of the drug if it is there, or assess the effectiveness, potency and purity of the drug, and monitor the therapeutic levels or the toxic level of the prescribed medication. So for that we do the drug assay. Like for example, serum level. Sometimes the doctor might have to check the serum level of phenytoin, which is the anticonvulsant, in a patient who is having convulsion, or urine test for the opioid, alcohol, and heroin, just to check whether how much addiction or how much is the presence of that drug in the patient's blood, and blood concentration of the theophylline, which is the asthma treatment, or sometimes the plasma level of vancomycin in hospitalized patient. Vancomycin is antibiotic, so if you are given, we need to check how much it is given, so we need to find out. So for all these things we carry out the drug assay. So let us understand the CPT coding structure for this drug assay. So we have, one is a presumptive drug class screening, which has the code range from 80305 to 307. They are not used for the therapeutic drug monitoring, more relevant for the drug abuse screening. Every word is very important, so I am putting a lot of emphasis on that. Then the definitive drug testing, this is the code range, typically used for the drug abuse or toxicology confirmation of the positive result. While the therapeutic drug assay, this is the code range. These codes apply when the drug level is quantified and monitored for therapeutic effect of prescribed drug. Again, I'm telling you, every word is important. Monitoring the therapeutic level of the prescribed medication, basically. So if you see, this is mainly whenever the drug has been prescribed by the doctor. This is mainly whenever you are trying to find out about the drug abuse. And definitive drug testing is also for the, it is for both, it is for the drug abuse and toxicology. Now let us understand the drug assay. The drug testing is divided into two major types. One is presumptive and one is definitive. Presumptive drug testing, it is a qualitative. Okay, it just shows or it just tells you whether the drug is present or absent. While the definitive drug testing, as the name suggests, it is definitive. Means it is giving you some definite information. It is quantitative. It tells you how much is present and what drug is present. So this is the the small comparison of the two. One is qualitative, one is quantitative, one is low, moderate, and high. This is presumptive is done by immunoassay, while the definitive is mass spectrometry, chromatography, and this is the code range. So let us understand the presumptive drug testing. The code range is 80305 to 307. What is the purpose of the presumptive drug testing? Is to find out the presence or absence of the drug, and depending upon that we get the positive or the negative result. What are the methods we use to do that? We use immunoassay, chromatography, or optical detection. And these three codes, they are divided depending upon how did we see the result. Like 305, usually it is a visual read. 3080306 is the instrument chemistry analyzer. While 80307, where we use a high complexity instrument to read the result. And remember, for the presumptive drug testing, we use only 1 unit per test per day, regardless of the number of the drugs screened for that patient. The excellent example of the presumptive drug testing is a breath analyzer, where the police will take the breath of a driver, and by checking the analyzer, they can find out whether the drug is present or no. But this breath analyzer does not give the idea whether how much is the quantity of that drug in the system. So for that they will have to carry the additional test. But this is the excellent example of the presumptive drug testing. So this is the screenshot of my book, which shows all these three codes, and you will see 305 presumptive, any number of the drug classes, any number of the device capable of being read by direct optical observation only. And here it is read by the instrument assisted, and here it is by the like ELISA test and the IA KIMS. So these are very, very complex, where we require the the chromatography or immunoassay, all this kind of things. So pay attention. How did the doctor or the pathologist read the report, because that will decide this code. Now let us look at the definitive drug testing. The code range is 80320 to 377, and these codes are used for the definitive drug classes. The testing could be qualitative or it could be quantitative, or we can use combination of both for the same patient on the same date of service. Each drug class is reported once per date of service. This is very important. And based on the analyte count, like analyte is basically the substance or the chemical being measured or detected in the lab test, code depends on the number of the analytes reported. So for example, if we are testing for 5 plus amphetamines, we will use the code 80326. We will not multiply by 5 because the code language says 5 or more. Then, if not covered into this 80327 to 377, we will use 80375, 376 and 377. These are the for the unlisted procedure. Unless some drugs we may find it in the therapeutic drug assay or the chemistry, depending whether you are doing it for the therapeutic or the prescribed drug, or sometimes we may find them into the chemistry section. So let us take one example. To report the code in hydrocodone, hydromorphone, morphine, oxycodone, oxymorphone, naloxone and naltrexone, how will I report? So I will report 80361, which cover this particular class, will cover the most of the codeine and hydrocodone and hydromorphone and morphine. And 80362, it mainly covers the naloxone and naltrexone. And for the oxycodone and we will have to take an oxymorphone, we will use 80365. So this is how we write the drug testing, the drug assay. And similarly, you can go through this example as well. So let us, go through the guideline. Use 80305 to 307 once per patient encounter, regardless of how many drugs screened. Use modifier 59 when testing same drug class with a different method, like methods or the samples, for example, urine and oral fluid, they are different sources. And definitive codes are per drug class, not per analyte. So this is very important. And the documentation must support medical necessity, method use, drug tested and interpretation. Now let us come to the therapeutic drug assay. It is a lab test which is used to measure the concentration of a drug in the patient system to ensure it is within the therapeutic range. Usually we carry out the therapeutic drug assay to monitor the drug effectiveness, avoid toxicity, adjust the dosage for the individual patient. And remember, the therapeutic drug assay, we use it for known prescribed drug, not for the screening purpose, because we have seen the presumptive and definitive drug assay, we use it mainly for the screening, but this is mainly for the prescribed drug, and these are the prescribed drugs. So what we do, suppose if the phenytoin, for the phenytoin we are doing it, I will code it 80185. Now let us take some question to know whether we have understood the guideline. So the first question is, a patient with a maniac depressive disorder is being treated with a lithium. The physician ordered the therapeutic drug test to measure the level of lithium. What is the correct CPT code? So first is, it is being treated with lithium. That means this drug has been prescribed. So we are going to concentrate on a therapeutic drug assay. And we have to find out they want to find out the level of the lithium. Okay, and these are the code. So what we will do is, we will check each and every code and we'll zero down our answer. So yes, option A is the correct answer, because this is here we can see the lithium, and this is a therapeutic drug assay, and we will zero down with A. So let's just take one more example. The physician performed the following test on her automated equipment: ADL, total serum cholesterol, triglyceride, and quantitative glucose, the correct CPT code, and we have the 4 options. Out of that, C and D is the panel code. So I'm going to check whether all these tests are the part of the panel. So if we check all those things, you will see that 80061, it has all the tests. So I can write the panel code. But the quantitative glucose is not a part of that. So what should I do? So yes, C is the correct answer for, because for all the tests which are there in the panel, I'm going to write 80061, and for the quantitative glucose test, I will write 82947. So C is the correct answer. Which of the following coding combination is an example of unbundling? So what is unbundling is basically separating or breaking down the bundle code into the individual code for billing purposes, and that is called as unbundling, and it is not correct for billing. So here are the options. I have given you the panel code, so tell me what is the correct answer. So yes, C is the correct answer, because these two tests which are written here, they are the part of the panel code, so I don't have to write them separately again. Now the 22-year-old comes into the emergency department with convulsions. The ED physician ordered the drug screening without identifying any specific drug class to be tested. The lab runs 2 drug classes screening using an immunoassay multiplex strips, and the results are visually read. The lab report comes back positive for alcohol and benzodiazepine. The ED physician then ordered the confirmatory test to be performed by the lab to confirm both positive results. What are the CPT codes are reported? Now, in this case, you remember that we write, the presumptive drug test code only once, irrespective of the number of the drugs. So that will help me to eliminate option D and C, because I never multiplied by 2 for the given patient. It is always once we have to write. Now, in between A and B, you have to tell me. So, in this particular patient, they have carried out presumptive as well as the definitive drug testing. So, what will decide our answer? Because if you see the second and the third code is more or less same. The first code will decide our answer, and that answer depends on how did the presumptive drug screening has been carried out, and it is carried out by the dipsticks, and results are visually read. So that should be your deciding factor, and that's why 80305 is the correct code and B is the correct answer. Now let us take one more example. A patient with a rheumatoid arthritis is being treated with gold. The physician ordered a therapeutic drug test to measure the serum level of gold. What is the correct CPD code for this service? Now I always tell the student, be a smart coder. Now what do you mean by smart coder is, first of all, you need to find out what is this therapeutic drug testing. And if you remember the code range here, it falls into 80 to 80299. So, you can eliminate option A without even going, but of course, I mean, always check it. But you can minimize your time. And in between these three, you need to find out the answer. So, tell me what is the correct answer. So yes, B is the correct answer, because 80329 is analgesic, and 80299, it is a quantitative of therapeutic drug, not elsewhere specified. Now, an 18-year-old female with a history of depression comes into ER in coma. The ER physician ordered a drug screening for the antidepressant phenothiazide and benzodiazepine. The lab performed the presumptive test for each drug class using the immunoassay. A definitive drug confirmation is done to identify the specific antidepressant. So here they have done the presumptive as well as the definitive drug confirmation, and we need to find out what is the correct answer. So if you remember the guideline that we write this code only once per day per patient. You can eliminate the option A and B, and in between C and D, we need to zero down our answer. So yes, D is the correct answer, and for this patient we have carried out both the qualitative as well as the quantitative. So for the qualitative, we are that is presumptive, we are going to write 80307, and because that test has been done and we have used the immunoassay method to check the test, presumptive test, and then for the definitive, we are going to use the 80329 because the drug they have seen is the antidepressant, phenothiazide and benzodiazepine. And remember, we will code it once because it includes a one or two, and that's why that will be coded only by 180329. Which of the following panel does not include chloride? And we have this option. Simple thing is you will go to the panel code and check whether the chloride is the part of that panel or no. Yes, it's pretty simple. 80061, which is the panel mainly for the triglyceride. It doesn't have chloride in it. Now, the patient uses topiramate to control the seizure. He comes in every 2 months to have a therapeutic drug monitoring done to assess the serum plasma level. What lab code is reported for this testing? So it is a therapeutic drug and the drug is topiramate. So, this is the presumptive. So we can, get rid of that. And in between B, C and D, we need to find out our answer. So yes, C is the correct answer, which talks about topiramate, and it's a definitive drug testing. So the last topic in this is evocative and suppressive drug testing. The evocative and suppressive drug testing involve assessing the endocrine gland function by administering the substance that stimulates or suppresses the gland activity and then measuring the hormonal response. So we usually carry out this test in order to diagnose the function of the adrenal, thyroid or pituitary gland, or evocative test is usually done to assess the response to the stimulation like ACT stimulation we do it, or sometimes suppressive test which is where we assess the response to inhibition like the dexamethasone suppression, or multiple specimens may be collected over time to evaluate the hormonal response. Uh, so remember, all these codes, what we are seeing here, they are mainly the panel code. So you see the language, and under that particular code, you will see all the tests which are there in that panel. So as far as the guideline is concerned, each code describes the full test panel, including the baseline and after the stimulation or the suppression level. Codes are typically reported once per complete test, not per individual sample. Interpretation must be documented when included in the code description. And always remember, for the panel, never unbundle the component that are the part of the panel. So this is as far as the evocative and suppressive drug testing. So let us take one example to understand this. A 48-year-old female is being evaluated for possible adrenal insufficiency. The provider administered cosinchopin, which is a synthetic acid, and obtained a blood sample at baseline 30 minutes and 60 minutes to measure the cortisol level in response to the stimulation. Which of the following is most appropriate CPT code to report this service? So what they have done is basically they want to check the adrenal insufficiency and they have taken the blood samples. So out of this four options, tell me the right answer. And yes, B is the correct option. And this is my last slide. We'll have few more parts to complete the path lab.